but I emphasize this. This pandemic is not over yet. We're only able to keep this virus in check while we ease restrictions if people act responsibly and follow safety protocols. That means continuing to wear a mask and social distancing. We want to strengthen our economy while keeping people safe. And it's on all of us to make that happen. The last thing we want is to backslide. Spring has brought sunnier days and the continued hope and belief that we will move past this pandemic. Our students are in the classrooms, people are getting vaccinated, and our COVID-19 numbers remain promising. But for us to truly turn the corner and leave this pandemic behind, we have to stay strong to the very end. We have to continue keeping ourselves and each other safe. That way we'll be able to move forward once and for all into a stronger and healthier future. Also with me today is our Director of Emergency Management, Mike Sprayberry. Monica McGee and Cameron Larson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take questions from the media. If you can identify yourself and your organization, and we'll take the first question.
Our first question will be from Tina Terry with WSOC.
Hi there. Thank you so much for taking my question. This is Tina Terry with WSOC TV in Charlotte, North Carolina. It's been predicted that we could move into vaccinations for Group 5 by May. Do you anticipate a supply increase that will allow us to move into vaccinations for Group 5 earlier than that time frame? Thank you.
We do anticipate an increase in supply, and in fact, Dr. Cohen and I just got off the phone with the White House Coronavirus Task Force, predicting that we will see increase in vaccine supply. So we are hoping that we can get earlier into the rest of Group 4 and into Group 5 even earlier. But I'm going to let Dr. Cohen address that specifically. Dr. Cohen.
Hi, Tina. As the governor said, yes, we do think that we will, well within the May 1st timeline that President Biden laid out, be able to open to all adults who are eligible to be vaccinated before May 1st. And in fact, are working with our vaccine providers right now to understand what they are seeing coming through their doors. And as the governor said, looking at options for potentially even accelerating, moving to the next phase of Group 4 and then into Group 5. So stay tuned as we work through that with our vaccine providers. And again, we are seeing more supply each and every week. It's just a small amount of increase, but even those small amounts go a long way, and we have put those vaccines to good use. We're getting them out fast, and I'm very proud of the equity work that we've done in getting our vaccines out. So we'll continue to do our fast and fair vaccine distribution across our state with the increase in supply that we see. We do hope that by next week we're going to see more Johnson & Johnson, the one-shot vaccine here in our state. We got an initial shipment of Johnson & Johnson back the first week it was authorized, and now we expect more to come to our state next week. Thank you.
Next question.
Our next question is from Michael Hyland with CBS 17.
Hi, this is Michael Hyland from CBS 17. I wanted to ask first about the decision regarding the capacity at various businesses. Since the bars have reopened a few weeks ago, have you noticed any significant impact that they have had on the spread of COVID-19? And if not, why continue to treat them differently than restaurants, breweries, and wineries?
So our healthcare officials have spent a lot of time analyzing data and grouping certain settings and activities into various risk columns. And the executive order is based upon those different levels of risks. And I will let Dr. Cohen address that more specifically.
Hi, Michael. Thanks for the question. We know in settings where you are indoors, gathered together, and you don't wear your mask consistently the whole time, those are places where this virus spreads. We've certainly seen that happen in some of our college campuses that are having some additional outbreaks. We're seeing that in sports teams as well, when folks are together, not wearing their masks all the time, and particularly when they're indoors. We know that is what happens in a bar. Folks are gathering inside together and not wearing their masks all the time. So we do still see that as a higher risk setting. We do feel like our trends have moved in the right direction so that we can move forward with further easing of restrictions, but we want to make sure we are still we're still following those underlying safety protocols, meaning wearing your mask when you can, when you're not actively eating or drinking, and still maintaining 6 feet of distance from other parties there at the bar. Thank you.
Next question, please.
We have a follow-up, Michael Hyland, CBS 17.
This question may be more so for Dr. Cohen. We saw in the CDC's tracker showing the number of cases, while still fairly low for the UK and South Africa variants of COVID-19, that those numbers nearly doubled over the past week. And while those numbers are still small, at what point does the rate of growth and the doubling time become an even bigger concern for you all?
Thanks, Michael, for bringing up the concerns about the new kinds of this virus that we are seeing circulating. We're often calling them variants, but we know this virus is changing. And we know particularly the one that started in the United Kingdom is more contagious, meaning it spreads more easily. So it is not surprising to us that we're seeing more and more cases with that variant here in North Carolina. Now, the good news is it, as you said in your question, it is pretty small, but we also know we are doing the gene sequencing on still a pretty small number of samples here in North Carolina. So we do expect for that virus to continue to spread, that strain of the virus or the variant of the virus to continue to spread in North Carolina, which is exactly why we have to maintain this balance. Use that dimmer switch. We can ease restrictions because our trends are moving in the right direction, but we're not out of the woods yet. This virus is here. This virus is changing. It's still contagious, and it is still cruel. It still takes someone's life if they are not protected with a vaccine. So we all have to protect each other and do the things we're talking about, which is do the 3 W's and get your vaccine as soon as you are eligible and it is your turn. Thank you.
And Dr. Cohen and other doctors have told me that even though the variants are more contagious, that the vaccine is still pretty effective against all of those. So that continues to show us that the more people we can get vaccinated, the better off that we are, and we're continuing to push toward that. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. I had a question about if the outdoor cap is being removed entirely on some businesses, why not just remove the outdoor cap on gathering size? And is that and the other changes to restrictions tied to the businesses being the enforcers, about people complying with it, or just that this has been a year now of the state of emergency?
Well, first, on outdoors at 100% for some of the venues, remember that we still, in those settings, have requirements for masks and social distancing, and it is a more controlled environment. We have the mass gathering limits just as something that can fill in the gaps for in places where you aren't in a formal public setting. For example, if you're in a big park, the mass gathering limit would apply to people who are coming together in the park, and we just don't want that many people coming together at one time, because the more people you get together, the more chance that the virus has to be transmitted. And it's much greater indoors, and that's why the gathering limit is lower indoors. Obviously, we still want the mask mandate and the capacity limits to be enforced. I think that since we have been doing this for a year, these protocols have become ingrained in businesses and in customers, and overall we've seen much better compliance over a period of time, because people have recognized that masks do slow the spread of the virus, that social distancing does, and that these capacity limitations can have success in driving the spread of the virus down. So as we continue to increase capacity limits, we want to continue to emphasize mask and social distancing. And we believe that since people are getting more used to this, that people can do it responsibly, and that we'll continue to have good success in bringing down our numbers and making sure they are stable, and finally getting enough people vaccinated so that we turn the corner on the pandemic. Next question, please.
We have a follow-up, Don Vaughn, News and Observer.
Yeah, and the follow-up, I think it was Michael Hyland's question about bars versus other businesses. Is there evidence beyond what Dr. Cohen cited about what we see in the university clusters that the alcohol curfew had an impact and the limits on bars versus other places that served alcohol?
Go and address that.
Thanks, Dawn. I think you'll see in this executive order, it is not just bars that we think are higher risk areas. Higher risk settings include any time when, as I said, folks come together, you can't wear your mask consistently, where there are a lot of people, you're indoors, you're singing, you're yelling. Those are the kinds of things that we know put this virus out into the air and spread it to other people. So not only bars, but there are other venues like conference centers, meeting centers, arenas, and others that we feel are higher risk. We want to keep the capacity at 50% at this point. Let's look at our trends over a period of time like we always do, and we'll use our dimmer switch as we go. And if things continue to be stable, if we continue to get vaccines to folks quickly, as we very much intend to do, then we will continue to evaluate our metrics and make more changes as we go forward. Thank you.
Next question, please.
Our next question is from Ashley Talley with WRAL.
Hi, thank you so much for taking my call. I wanted to ask about the change in vaccine allocation that DHHS announced in the past couple of days, where you are allocating based on percentage of people in a county that haven't been vaccinated rather than number of residents in a county. Can you talk a little bit about that decision and why you think pushing vaccines to those areas will change maybe uptake rates or mindsets there of people that don't want to get the vaccine? And are you concerned that this new approach could lead to more unused doses sitting on shelves?
Well, thanks for that question. And we've been really looking at our data very closely every single day. We are making sure that we can get vaccine out, as the governor said many times, fast and fair. As we went into this effort, this is all the way back in December, we really looked at the county's population and use that as our guide for how do we want to allocate across counties to make sure we're reaching all 100 counties and lots of different communities. But we now know that folks are crossing county lines to get their vaccine, which they're totally able to do. But then we need to look at how many in a particular county are vaccinated or not. And then we want to be sure we're sending more vaccine to the places where folks aren't vaccinated. So that's the change that came over the last number of weeks. We've worked with our vaccine providers so they had that time to have that visibility to know we were going to make a change in their allocation so they can adjust. Every week we ask them, do they feel that they can take on the amount of vaccine that they are being allocated? By agreeing to take it, they are agreeing to be fast and fair. They're agreeing to get it out before the next shipment comes, and they are agreeing to do that in an equitable way that reflects the community that they serve. So every time, every single week, they are saying yes to that. And there are some that say, this week we need to accept less vaccine, and that's fine. And we work with other providers and make sure that we have vaccine going, again, to all 100 counties. And that is when we've been able to bring on additional vaccine providers. If we see one vaccine provider isn't able to meet the needs of their community, we look for other partners, or we use a paid vendor through the state to even fill in those gaps there. So again, keep monitoring to make sure we're fast and fair. So we do think this new formula is better at matching up where are people unvaccinated and matching it with vaccine there and making sure we're keeping on top of providers to get things out fast and fair. And I will say they've been doing a terrific job, and it is why North Carolina continues to be recognized nationally for the work we're doing. Thank you.
Next question, please.
We have a follow-up, Ashley Talley, WRAL.
Thank you so much for that thorough answer. I really appreciate it. One quick clarification, does the reopening of 50% for sports arenas include high school sports? And one more quick question about charter schools not being included in SB 220, hearing from a lot of parents about that. Do you think that they should be included, or is there any movement to do that right now? Thanks so much.
So yes, the 50% does include high school sports and observing those, both 50% indoors and outdoors, and the same rules regarding social distancing and masking requirements. I'll let Dr. Cohen address the schools issue.
Thanks, Ashley. As I mentioned, DHHS updated our Stronger Schools toolkit today, and it did include guidance not just for K-12 public schools, but charter schools as well. And within